Diabetes globally is a leading cause of death, and in India is the seventh major cause of death. So Asians are about 2 to 4 times more prone for developing type 2 diabetes. When we look at the consensus through WHO, it's 7.3% of Indian population which is diabetic, 10.3% of patients or the population which is pre-diabetic, and about 47.3% of patients who are undiagnosed or they are not even being checked and they are diabetics. So what is diabetes? Diabetes is a chronic metabolic disorder in which the body is unable to utilize glucose either partially or completely, and it causes increased concentration of glucose in the bloodstream, and it hampers the carbohydrate, protein and fat metabolism, and which can be due to the failure of either liberation of insulin or production of insulin or the action of insulin. So this is a medical definition, but when we talk for the layman, it is a disease. Diabetes is a disease which basically affects the body in terms of using the sugar or the glucose. Let me first explain what is the normal physiology or when we are talking about insulin and we are talking about glucose. So what is insulin? So insulin is a hormone which is produced in the body by a gland called pancreas, by the beta cells in that, which is just behind the stomach, lower down in stomach, and the insulin is released into the circulation, which picks up the sugar and which makes the sugar enter the cells, which is required for the formation of the muscle and tissues. So as the blood sugar increases, the insulin uses that, and as the blood glucose levels decreases in the blood, the insulin automatically ceases, or the insulin secretion stops from the beta cells. That is a normal physiology. Now what is glucose? Glucose is a form of energy which is used up by the cells to form the muscles and the tissues. It is been stored in the liver as glycogen. So whenever required, it gets broken, the glycogen is broken and the glucose is released in the bloodstream. So when it is required, when we are fasting or we are not able to eat for a longer time, it's the body which compensates this way. So this is what is a normal physiology. When we talk about the type of diabetes, be it any type, the ultimate thing is there is increased sugar levels in the blood. So the chronic types of diabetes are type 1 and type 2 diabetes, and the potentially which can be reversed gradually are the pre-diabetes and the gestational diabetes. Pre-diabetes is basically in which the sugars of people is higher than the normal target range, not more than the target of diabetic target. So that is pre-diabetic population. And gestational diabetes is basically patients who develop diabetes during pregnancy time, which reverses back after the childbirth. So let's discuss type 1 and type 2. What is type 1 diabetes? Type 1 is basically known as a juvenile onset diabetes. It is an insulin-dependent diabetes mellitus, which is an autoimmune disorder in which the production of insulin is negligible in the patient. So the body is not itself producing insulin. Type 2, which is far more common than type 1, is basically associated with, it's majorly seen in adult population who are more obese. And the criteria which is involved with that is insulin resistance because of the centrally associated fat and the food habits, obviously. So that is the major reason for type 2 diabetes. The causes of diabetes. Now, what are the causes? Why the sugars are high? Maybe you have a family history, maybe you had some PCOD, the polycystic ovarian disease in the female, or the major thing is obesity, blood pressure, the high cholesterol values, and metabolic syndrome. And obviously the environmental factors, the lifestyle. People who are obese, who overeat, who are underactive, a sedentary lifestyle, which goes more in favor of getting this disease called diabetes. Obesity really acts as a diabetogenic factor for having this insulin resistance. The insulin which has been produced is not been working properly because of the excess fat content in the body. So reasons being consumption of more refined grains like rice, which is a staple diet of most of the families, more of saturated fat, alcoholic stress, normal stress, what we are going to trans fatty acid, junks, what we are eating, sedentary lifestyle. Obviously, the abdominal circumference plays a major role. The abdominal fat, the central fat. We calculate with the waist to hip ratio. The higher that waist to hip ratio, more risk of developing type 2 diabetes. If we talk about the waist circumference, I can give you an idea of about more than 84 centimeters in females and more than 94 centimeters in males contributes to risk of developing type 2 diabetes. Insulin resistance being the condition which is responsible for that because of the excess fat accumulation. When we talk about the symptoms, it's not necessary that every person who is pre-diabetic, who is a gestational diabetes or a type 2 diabetic will have some or other symptoms. It can be just a routine evaluation and you can see the patients with high sugars. Type 1 definitely have the symptoms more as compared to type 2. But the symptoms which can be seen, if I talk from head to toe, the first can be hair loss. That is one thing which is seen. Hearing impairment, blurring of vision, weight loss, though we are not trying for, excess urination, more than normal, excessive thirst, which is again more than normal, muscle weakness, fatigue, mood disturbances. These are few of the symptoms to talk about. Recurrent infections, maybe of the gums, vaginal infections, urinary infections, skin infections. These are some of the symptoms which have been seen in patients. So who should be checked for sugars? People who have a family history of diabetes, females who had PCOD, who had gestational diabetes, people more than 35 years of age with other comorbidities like blood pressure, cholesterol, hypothyroidism, they should be screened for sugars. What do we see normally with sugar? When we check, if we check for the random blood sugars, if the number is more than 200 milligram per deciliter, they should be actually screened with all other blood tests also, checking for their HbA1c, which is 3 months average of the sugar, which should be less than 5.7 in a normal population. But if it is between 5.7 to 6.5, it is a pre-diabetic range. And if it is more than 6.5 on two occasions of checkup, it is labeled as a diabetic. And when we check at fasting levels, less than 100 milligram per deciliter is normal, 100 to 126 is pre-diabetic, and more than 126 again at 2-3 consecutive readings, you are labeled as a diabetic. Along with the sugars, we should definitely go for the checkup of your kidneys, your eyes, your liver, in terms of fatty liver, your thyroid checkup, urine, basic CBC. These are all the tests should be taken for the people. Treatment, the first thing involves is the diet and exercise, which plays a major role in people with type 2 diabetes. Diabetic diet is no different. We have to have a balanced kind of diet involving all carbohydrates, proteins, fat, fiber, vitamins, all the nutrients. Everything plays a role in controlling the sugars. By just modifying the diet, you can even get down the sugars. Let's talk about the carbohydrates first. So high carbohydrate, high fiber diet, which is recommended. About 45 to 60% of your total calorie consumption should be carbs. But the carbs should be complex carbohydrates, not the simple carbs which are rapidly absorbed like sweets, chocolates, cold drinks and sweetened drinks. So high fiber and low GI index. GI is basically glycemic index food is what is advised. Then coming to the protein part, 15 to 20% should be calories in terms of protein should be consumed in a diabetic patient. It helps in the release of amino acid which are required for tissue repair basically. Pulses like beans, peas and lentils are the ones which are high in protein and low in fat, plus low in the GI index and the glycemic low. So these are good proteins to be taken. Vegetarian proteins are much more beneficial than the flesh foods as they are low in cholesterol level and there is less fat accumulation with that. So we prefer vegetarian proteins rather than the fresh proteins. Coming to the fat. Fats, again 15 to 20% of your total calories should be fat. It really helps in insulin binding and controlling your LDL, which is the bad cholesterol, and decreases the incidence of atherosclerosis. So what kind of fat? If we are a non-vegetarian, fish and chicken can be consumed, but without the dressings. Mutton or red meat, brain or the liver part should be avoided. Another protective fats can be fruits like avocados, flax seeds, spirulina, fish oil, fenugreek seeds and all. They can be consumed in moderation. They are good healthy fats. The nuts, the seeds, they are very healthy in form of the protective fats in the patients with diabetes mellitus. Cold pressed oils and blended oils are preferred in this kind of patient. Coming to vitamins, the balanced diet, we don't require any extra vitamins, but people with diabetes on medications, it's preferable to give vitamin B12, vitamin D, and iron and calcium, especially in vegans and gestational diabetes or lactating mothers. We are supposed to give that. Talking about fiber, which is again very important aspect in this, fiber along with carbohydrate does help in reducing sugars in both type 1 and type 2 diabetes. It reduces the insulin requirement in people who are taking insulin, helps in reducing weight, helps in reducing blood pressure, it helps in reducing fasting blood sugars, it helps in reducing cholesterol, triglycerides, everything. So what type of fibers? Soluble fibers in the form of whole grains and vegetables. They decrease the intestinal transit time, they increase the fecal bulk and delays the glucose absorption, and it also helps us attain the satiety level. So what is a good fiber which is available is fenugreek seeds, which has about 40 to 60% of fiber. If we include that in our diet early morning, that really helps in the weight reduction, in reducing your cholesterol levels, blood pressure, everything. So in total, it helps for everything: your diabetes, your blood pressure, your dyslipidemia. Fiber is equally important in the diet as with along with carbs, protein, fats, and everything. Of course, here's the fluids. Normal fluids, but you should avoid your sports drinks, sweet colas, and sweetened fruit juices, soft drinks. That should be avoided. So what exercise do we recommend? It is basically a combination of strength training and cardio exercise, that is aerobic exercise. Now, why strength and toning exercise is important? It is basically strength and toning for muscle. It uses the energy, the glucose only it uses, and which helps to improve the action of insulin. So at least 3 days of strength training and 2 days of cardio, which helps in the utilization of oxygen to the muscles. So that should be a combination exercise. So if I say it should be 150 minutes per week, so 30 minutes per day for at least 5 days a week should be preferred for all the people with obesity, diabetes, blood pressure, everything. But yes, if the sugars are very high or you are prone for hypoglycemia and the low sugars, you should avoid exercising. For avoiding all this, we should maintain an ideal body weight. We should be 10% less than what is advised. So how do we know our ideal body weight is? Height in centimeters minus 100. So that's your ideal body weight, but it should be 10% less than. So losing just 7% per month of that will really help you reducing the risk factors of diabetes, blood pressure, high cholesterol levels, and everything. And
Eh-Maaya Lab is all about giving you correct information from doctors and experts. For more such content, subscribe to our channel and click on the bell icon so you never miss an update. Also, you can check these videos out.